Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers managing quality and safety in community and public health programs. By the end of this lesson, you should be able to define quality assurance and explain its role in continuous quality improvement. You should be able to discuss at least two general and two specific approaches to quality improvement and examine ways to use them in practice. You should be able to plan a model quality assurance program if you want to. You should be able to identify the purposes for the types of records kept in public health agencies, and you should be able to evaluate a method for documentation of client care in a community setting. As an RN, you should be aware that healthcare delivery system is the largest employing industry in the U.S. Society is demanding increased efficiency and effectiveness from the healthcare system. Okay, so what is quality control? Quality control is the tool used to ensure effectiveness and efficiency. So we're trying to make sure that we're effective and efficient in what we do as nurses. The managed care industry is changing the face of the American health industry, and that's how quality will be defined and measured is important to us, not just for our profession, but it's also important for our practice. The objective and systematic evaluation of nursing care is a priority, and this is done by nurses. It is a priority within the profession for several reasons, including the effect of cost on the healthcare accessibility, consumer demands for better quality of care, and the increasing involvement of nurses in public and health agency policy formulation. We know that our role as nurses is changing in the healthcare landscape, and we want to make sure that we continue to understand quality control and deliver quality care. As you practice in healthcare, you'll hear the terms TQM and CQI. TQM is total quality management and CQI is continuous quality improvement. TQM CQI is a management philosophy used in healthcare. It is prevention oriented and a process evaluation focus. The concept of quality includes customer satisfaction, so that is why you're going to be asked to make sure you pay attention to patient satisfaction. Efforts are being made by the public and private sectors to form partnerships to monitor the performance of all players in healthcare delivery for the purpose of improving health in communities. How do we assure quality in healthcare? Quality assurance. Quality assurance is the monitoring of activities of care to determine the degree of excellence attained in the implementation of those activities. Quality assurance has been a concern for the profession of nursing since the 1860s, when Florence Nightingale called for a uniform format to gather and disseminate hospital statistics. So we have been doing quality assurance in nursing as long as we've been nurses. Licensure has been a major issue in nursing since 1892. We know how hard we work for our nursing licenses. That is a way we assure quality, that not everybody becomes a nurse. Only quality conscious individuals do. Two major categories of approaches that exist in quality assurance and improvement today are general approaches and specific approaches. Okay, so accreditation is an approach to quality assurance used for institutions, whereas licensure is used primarily for individuals. Certification combines features of both licensing and accreditation. So these are just examples of what's done for quality assurance, so you understand what is licensure, what is accreditation, all those things. What is certification? What does it mean somebody is certified? All those ways are ways of us assuring quality. Okay, I want to tell you a little bit of about three models that are used to evaluate quality. Feel free to look them up and expand on that knowledge. The Dunabedian structure process outcome model is one of those, and there's also the Sentinel model, and there's a TRACER model in quality assurance. I briefly touch on 7 basic components of a quality assurance program. We want to make sure that we're identifying values, we're identifying the structure we're working with, the process and outcome standards criteria. We want to select measurement techniques of how we're going to measure quality. We want to interpret the strengths and weaknesses of the care that's given. We want to identify alternative courses of action, and we want to choose specific courses of action, and then we want to take action to make sure that quality is assured. Records are an integral part of the communication structure of any healthcare organization. We also want to make sure we have quality in record keeping. Accurate and complete records are required by law of most of all agencies that in healthcare, and we want to make sure that we are being accurate in record keeping and complete in record keeping. Quality assurance and improvement mechanisms in the healthcare industry are mechanisms for controlling the system and requesting accountability from individual providers within the system. You as a nurse will have to be able to participate in that. Records help establish a total picture of the contribution of the agency to the client or community. Thank you for listening to this lesson. I hope you have enjoyed this overview of how nurses can be involved in managing quality and maintaining safety in the community health settings and in other settings that we practice in. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.